So let's talk a little bit about a review of what we heard yesterday. The words that as I was thinking last night about the day, the words that we kept hearing over and over again were innovate and integrate. And of course, we put that all in the perspective of transforming healthcare. So we had some events yesterday that not all of you had an opportunity to participate in. We had three pre-sessions that were going on. One was a meeting of our policy, privacy and security advisory steering team that is an advisory to me in our policy matters for California. But we also had one session on the update for the model modular participant agreement. I always flip the M words for data sharing. And then there was a great session, and all the sessions were fabulous. I went and peeked in at the back of the rooms, and people were just rapt with what they were hearing. One of them was a session about the new HIE toolkit for provider decision making, and Kathy Kim with our colleague Mark Elson from CalHIPSO talked about evidence-based tools that allow providers and communities to figure out first what problem it is they're trying to solve, and then decide whether HIE is the answer to the problem. I, of course, have to, in my role, believe that HIE is the answer. But depending on the problem to be solved, perhaps it is only a part of the answer. And that's really the key insight that communities need to have, because we have to remember that our zeal to get HIE off the ground doesn't necessarily mean that it will solve all communities' every problem. And then one of the sessions was on the Rural HIE Incentive Program, and CHEC's Raina Kaplan brought to our attention that the new incentive program in rural will pay 2/3 of the fee for rural providers to connect with existing HIE service providers. And then she gave a quick rundown on the individual approaches to HIE, their varying choices of vendors, and the role of direct, which we heard repeatedly throughout the day, and that provided, I understand, for a very lively conversation in that pre-session. I talked yesterday about how big culture change is what we're all in the middle of. We're living through a huge culture change in healthcare, and I didn't say it in my comments, but last night at the reception, I shared with someone that I kind of think of this in terms of two other huge culture shifts that we've had in the United States. One of them was centered around a new technology, if you will. Well, both of them were. The invention of the automobile, and how that was a huge culture change that required some change to the way people moved around and how you got from one place to another. Paved roads in towns where automobiles were, and then, let's pave roads between towns so people can go from this town to the interstate system, whether you love it or hate it. And that didn't happen overnight, and it certainly didn't happen in 4 years. And then the other one was the invention of the light bulb. And everybody loved it. Wouldn't that be great if we didn't have to worry about candles and all that? But that didn't happen overnight either. But now those are such pervasive drivers in our environment that we can't imagine, except by choice, that we don't take advantage of those two options. This is culture change too, and it takes time, and it takes effort, and sometimes it's trial and error. One of the things I wanted to remind us was to keep our sense of humor, and we played with the double dog dare from those naysayers who say that, well, this is all just an experiment gone bad. We don't believe that in California, and we are taking this as when we were children and someone dared us to do something, and then they double dog dared us, and then of course we know there's one level beyond that, but I wasn't going to go there. I was only going to double dog dare you. And even in the face of that, we're seeing rapid change and rapid improvements and rapid efforts in California. We've seen in 6 months the Western States Consortium morph into a new organization that is a registered 501c3, and we in 2 months, less than 2 months, have seen California develop a new governance mechanism and a new association of health information exchanges. Now, someone asked me this morning, they couldn't find anything about that on our website. Well, that's because we didn't put it on the website until this morning, because you're going to hear about it in detail today with a presentation later in the morning. And then we heard Secretary Dooley talked about putting all of this work that we're doing into a bigger perspective of healthcare reform. And isn't that really what we're doing? We really are reforming healthcare. What we're doing may or may not have anything directly to do with reimbursement and costs and cash flow. Certainly it has to do with costs, but it may not have direct cash flow implications for providers in the long run, but it is healthcare reform. And we're challenged to make California the healthiest state in the nation. What would that look like if we were the healthiest state in the nation? Pat Powers, who directed the Let's Get Healthy California Task Force, talked about the big picture goals and aspirations for health in California for our citizens, and she talked about how we are going to measure that in very meaningful ways, and in ways that are, in many cases, already using data that's being reported, so we're not creating new reporting requirements. But we have to work harder to provide our best care to those who haven't had access to it in the past, and to those who are at the end of their lives. Pat reminded us that HIE is a foundational building block of everything that is occurring in California specific to changing the healthcare culture. Dr. Kaiser excuse me, offered us observations from his perspective, and he does lead the cutting edge of thought about information technology and improving population health. He's embedded in the academic world as well as the policy world. We heard that the poor man had a terrible time getting here because he'd been in New York the day before and he couldn't get home as he planned, but that's because he travels the world on talking about healthcare policy and health information technology and quality. But he maintains the ability to see the bigger picture from an outside point of view. So even as CHEC, his organization within the Institute for Population Health Improvement works to create new disease-driven, data-driven disease registries. They're looking for ways to make that work useful to patients and every day to providers as they treat the patients and make it useful as well for the analysts, because it's not just about having data for data's sake, it's about having data to change the world. And then he reminded us, and I think this was my primary takeaway from his conversation, that our jargon is not doing us any favors in helping the rest of the world understand what it is we're trying to do. As an example, he didn't talk about this, but as an example, we now talk in California about 2 health exchanges. One is Health Information Exchange and one is the Insurance Exchange, and I can't tell you how many calls I get with people wanting to talk to me about the Insurance Exchange. So we haven't done ourselves any favors by creating confusion just in our jargon and in acronyms and in concepts as we use them. If others in healthcare, much less the rest of the world, don't understand what we're trying to do, we won't get their help, and we have to have that. We had a panel, a talk-back panel, and we're going to have 2 or 3 of those today. This one was on meaningful use, and it's good. There's good news, and then there's some really scary stuff. Lots of California providers are making stage 1 meaningful use happen, and they're using it to improve patient care, which is what it's all about. But just about everyone is worried about the challenges that stage 2 will bring, particularly with fewer technical support resources available. Oh, and then there's the irony of this whole thing, and Lori Hack reminded us that if you have to print out the care summaries in order to provide meaningful use of your electronic health record, that is rather ironic. We also heard the important perspective of critical access hospitals who continue to find creative ways to survive against the odds. And I know for many of you, you were shocked to hear the trainers were at a hospital for a week and they didn't have a single admission. But I come from the part of the world where, gee, that's kind of the norm. And so the challenges they face is you have to have all your staff there, you have to have the doors open, you may not have any patients admitted. And so the challenge of how do you pay your bills when your census is low, but you provide critical, and that's why they're called critical access, you provide critical services in those communities. And one of the things that Margaret did not say to you, but I will share with you, is those hospitals in many cases are the largest employers in those communities as well. So the economic as well as the healthcare impact, if those hospitals do not succeed in this new environment, would be devastating. But all of that aside, nearly half of the nearly half of the hospitals in the network that Margaret spoke to us about are meeting meaningful use stage 1 criteria. That's pretty awesome. And then we ended our day with some fun activities and also with some comments from Pam Matthews from HIMSS. And she reminded us of how quickly things have changed. My takeaway from her talk was the slide where she had, this was what the world looked like in 2010, and this is what HIE looks like in 2012. 2 years, massive shift. And I have to tell you, we are not behind the curve on that shift. We are out in front of it. And it was, I sat here with a big smile on my face because that is exactly where California has gone in those 2 years, and I'm very, very proud of that. But she did remind us that things will continue to change very rapidly in the months and years ahead in ways that we can't even imagine. We finished up with examples of HI innovation from the floor, and we brainstormed about what some solutions might be, and then we had a phenomenal reception. People were engaged, sharing ideas, talking about things that have worked, talking about things that haven't worked, and our conversation has been inspiring our friend Regina as she is carrying on with her walking gallery efforts on behalf of the patients. And I'm anxious to see what her final creations are today and have her share her observations with us. So with that, I want to start off today by doing an activity that may help wake you up, and some of you will just hate it. So anybody in this room who has volunteered their time, their money, their energy, their effort to support health information exchange in California over the last 4 years, I'd like you to just stand up. And I'm going to tell you why this is so important. So if you have volunteered, and I really think everybody in this room probably could be standing up right now, get on your feet. Well, 1, 2, okay, now people are waking up. Hello, it's morning. Come on, let's wake. Okay, so thank you. Now you can sit back down and go back to sleep. So one of the things that we thought was going to be such a challenge in California was to meet the federal match requirement for our HIE state grant, our cooperative grant. We are required to put up a matching % of what we receive from the federal government. And of course, being California, we sit on piles of money behind the curtain that no one sees. No, that's not true. I'm being sarcastic. We have no money. We know that. So we really were very concerned about how we were going to do that because it's millions of dollars. But the efforts of those volunteers have allowed us to claim in-kind match, and there have been hundreds of thousands of hours donated, volunteered, and that we can claim as in-kind match for that federal requirement. So those of you who stood, and those of you who didn't stand because you just didn't feel like it, but who have volunteered, thank you. You have allowed us to continue the work in California. And one of my staff reminded me that I needed to point that out to you, because while California doesn't have piles of money sitting in the back of the room, we do have people who are willing to step up to the challenge and donate their time and their energy and their expertise, and that has made all the difference in the world for us. One of the things that I hear when I go to ONC meetings is the other states say gosh, we wish we'd done what California did. And I think, oh, okay, well, what do you think we did? And they said, well, the states who say that are the states who followed the rules, which we don't always do particularly well in California, and who created a single statewide HIE, like they were asked to do. Because now they are at the place where they say, but you know, if we can't figure out how to keep that going, and they use the word, that S word, sustainability, if we can't figure out how to sustain the state effort that we created, we've just killed HIE for our entire state. You guys in California didn't follow the rules, didn't do what we are not Vermont. You heard that yesterday. And I have actually been said, you know, we really wish you guys could be more like Vermont. Well, so do we. They have great cheese, but we're not Vermont. And so the states are now saying if we had done what California did, and we had multiple HIE efforts, and we could work on connecting those HIE efforts, the sustainability challenge would look very different. So in California, when we talk about sustainability, we don't talk about money because we're California. We talk about sustaining the efforts, what that will look like, and that's what the future looks like for us. You're helping us do that. You've helped us get to that place, and I think you need to give yourselves a huge round of applause because you are staying the course and embracing the mission. So thank you from my staff and government and to each of you. Thank you.